To all. Thank you for joining us tonight. We want to welcome everyone for joining us for this important discussion on the impact of COVID-19 on young children. We also want to thank our panelists, Dr. Kasper. We want to thank Sara Skonieczny, and we're gonna thank Kathleen Baylor for joining us tonight. We also want to thank Katie. Katie is our development associate, and she's part of our production. I'm just going to start with some introductions and some bios so that you know the panelists and the background. Dr. Kasper has been a general pediatrician with the Cambridge Health Alliance in Somerville since 2004. Dr. Kasper is an assistant professor of pediatrics for Harvard Medical School, and she's our health care consultant, EPH healthcare consultant. She's on the board for the Community Action Agency of Somerville, and she's the mother of a former EPH preschooler and a great supporter to our staff in times of need. We have Kathleen Baylor. She has a master's in education. She's the new director of early education and care for Somerville Public Schools. Kathleen brings nearly 30 years of teaching and leadership experience to support the implementation of a comprehensive, integrated, mixed delivery early education system in Somerville and ensure that all students meet and exceed the kindergarten readiness benchmarks. Ms. Baylor earned a BA in art from Bucknell University and an MS in education from Bank Street College of Education in New York. Prior to coming to Somerville, Ms. Baylor worked as a principal in public school, as a director of private school, as an early childhood consultant, and a teacher in grades pre-K through 5th grade. Sara is a clinical youth specialist for the city of Somerville in the Department of Health and Human Services. She's a licensed independent clinical social worker and received a master's in social work from Boston University with a specialization in trauma and group work. Sara has over 15 years of experience working with youth and families in many different settings and with a range of ages. She has worked with individuals around a variety of concerns, including anxiety, depression, trauma, commercial sexual exploitation, substance use, self-harming behaviors, and grief and loss. In her role in the city of Somerville, she provides support for youth who reside in the city, their families, and the programs that serve them. Sara also provides leadership to the Somerville Trauma Response Network, a group of volunteers trained in post-traumatic stress management and psychological first aid who offer support to the community following traumatic events. So we want to thank you all again for coming and joining us for this discussion. I just want to say that we're going to record this webinar for the benefit of some other parents who are working or their schedule conflict with this event. The format is very informal in the sense that it's a Q&A format. So there's not going to be a formal presentation with PowerPoint presentations like that. We're going to ask some questions to the panelists, and the panelists are going to answer those questions according to their field. We have represented different fields here, the medical, the mental health, and the education or the school. And we wanted to target those fields specifically. If you have any questions, you can post them in the Q&A chat room, and we will answer them as they come, okay? We hope that this could be the beginning of a meaningful conversation, that we can start some of other of these conversations, important conversations, throughout the year. So let me start by saying, and I found this in one article that I read, specifically COVID-19 and K through 12 students, barriers to meaningful access, opportunities, and outcomes. And in that article, it reads that last May, nearly 3 in 10 parents surveyed in a Gallup poll said their child was experiencing harm to their emotional or mental health, with 45 of them citing that the separation from teachers and classmates as a major challenge. So we know now this is going to be 2 years in this endeavor, I should say, that our children are experiencing some changes in behavior, some changes in their emotional well-being, and we want to start understanding those changes. We want to start understanding what can we do to help them process some of these changes, right? And so let's begin with that question. Let's begin with a very important question. What impacts of the pandemic have you observed in your field? And let's start with Dr. Kasper. Dr. Kasper, could you give us some idea of what you have seen in the field?
Yeah, so thanks for having us, Kretcha. And Katie, thanks for organizing this. So I'm a general pediatrician. I see kids birth to 22. And, you know, generally pre-COVID, my office would be a combination of kids coming in for physicals, maybe some kids with, you know, occasional kids with depression, stuffy noses, some sports injuries, things like that. And, you know, I think, you know, for the longest time, particularly early on in the pandemic, I just didn't see a lot of my patients because nobody was seeking routine care. We have a huge backlog of kids who are behind on immunizations and routine care. I'm seeing people who haven't been seen in a really long time. So they're missing vaccines. They may have growth or development or behavioral problems that weren't appropriately managed over the last year and a half. And have gotten a little bit out of control. I'm seeing lots of kids with weight gain, just from sedentary behaviors and kind of being trapped at home, and, you know, being scared to leave the house, and even not, you know, there are a lot of families who are still hesitant to have their kids go to the playgrounds. So kids aren't getting the exercise, they're spending too much time on screens. And I've also seen a fair number of adolescents develop kind of the opposite, really unhealthy eating behaviors. You know, I had one patient who we spent about 6 months trying to get in an eating disorder program because the wait lists are so long. So I think that I've been, you know, what I say is we take this group of kids who their job in, you know, adolescence and preteens is to kind of separate from their families, and we locked them at home with their parents, right? And so they haven't had that opportunity to separate. And so a lot of anxiety, a lot of depression, which I'm sure Sara will talk more about. And you know, problems with access to services. So I've been playing psychiatrist a lot. I've been really working hard to kind of help bridge the gap before my patients can see people like Sara.
Sara, same question. What has been your experience working in the city?
Yes, so I think the first really important thing to note is that even prior to the COVID-19 pandemic, we were in a mental health crisis for everyone, especially for young people. Is we were seeing a lack of providers. We were seeing really long wait lists for kids to see providers, so 6 to 8 months waiting to meet with a therapist. And the pandemic has only exacerbated that. So a lot of kids went without services during those times. And so whatever they were dealing with pre-COVID has just kind of gotten worse. And add into that isolation, not being able to socialize, and just really kind of a lack of joy and enjoyment, being able to kind of get out there and do all these things we're looking forward to, and just so much grief and loss, just like loss of a year, loss of school time, loss of all of these experiences that we wanted to have. We're really just seeing kind of an increase in mental health concerns for young people. And this is including anxiety. So a lot of kids are just are scared of everything that's going on in the world. They're feeling pressure to catch back up, especially in like the high school and in those transition grades. So kids who were freshmen last year who really didn't go to school, they're now sophomores, they're feeling like they've missed so much. Those younger kids, the middle school transition, and even that kindergarten, first grade, we're feeling kids feel a lot of pressure to kind of get back to where they needed to be. A lot of depression, I think that we see it with adults, and it does kind of trickle down. One thing that can help with depression too is feeling like you're doing something. And so I think for a lot of people, being able to follow some of the safety protocols to get the vaccines, it felt like we were doing our part. And I think for young people, they haven't necessarily had that opportunity. And so they've missed out on feeling like they spent a whole year at home, you know, kind of protecting everybody that they cared about. And that's still kind of all they can do is take some of those precautions and not really take steps. So it doesn't feel like they're being active and kind of helping sometimes. So that can exacerbate some of those depressive symptoms. I think we're just also seeing some socialization and some attachment. We have all these young kids who are home, you know, with their parents and who had kind of constant access to them. And now we're sending them back out into the world to have to separate because people have to go back to work. They have to go out and earn a living. And it's really hard for kids to understand. And not just those young kids, the older kids too. You know, families get into routines of having dinner at home and having more time to spend together, which was one of those kind of bright moments. And now those are kind of going away. So finding that balance again is really hard, and kids are kind of left with where to turn. And again, we're just seeing less and less providers than even before the pandemic, it feels like. And I think some of that is that mental health people are really burnt out too, is that they spent the whole pandemic kind of supporting people while also trying to deal with their own things that were going on. And now we're still doing it. And so I think that that's been another challenge, that we just haven't seen people engage in the same way, which has been difficult to get kids the help that they need.
Yeah, you highlight a very important observation, the pressure to catch up, because you can see that across, right, from all ages. It's not only the older ones, but the young ones as well. So I wonder about Kathleen, what do you have observed in the educational settings?
Right. So as I'm new to Somerville, I asked a bunch of people in the community, and I asked our center directors. So a lot of what I'm about to tell you is based from our center directors, but I can also speak to my own experience as a school principal as well.
Yeah.
So one of the things that the center directors really have noticed is that support services for developmental delays were not utilized in the same way. So many children didn't have those early intervention experiences and like that in access to the pandemic. So right now they're coming into the centers and into our schools with more needs. And I think that was, you know, evident in what you just heard. Caregivers, we've also seen caregivers having an added layer of stress and feeling burnt out to varying degrees. And that can really impact everybody. So it can impact how people are regulating, co-regulating, and that's something to be mindful of, because it does trickle down to the young children and adds stress. Kids who thrive from a structure of school had a harder time learning at home due to different structures and routines. It's just different. And then we did see that parents were overwhelmed trying to figure out how to balance, especially putting young children on Zoom, which is just not in their nature to sit still and to even comprehend, you know, talking to other people over Zoom like this is very difficult for a young child. And that was also very difficult for parents. And then balancing that your work life at home with learning online was nearly impossible. The other thing, there are some positive aspects that we have seen as well. Children have become more independent quicker. I think they just needed to do so. Some kids thrived at being at home. They had, access to caregivers, and that really bolstered their self-esteem. And they came into school less anxious and much more mature than when we saw them before. Like the growth, the social emotional growth was quite high for some children. And so we found that it was very individual how children are affected by the pandemic, and I think it's complex as well. The other thing is we found is that children have been picking up social cues in a different way. Teachers have been noticing that children are really focusing on the eyes, and that they're also expressing through their eyes because we're not able to see each other's mouths.
That's so interesting.
So I think, and that speaks to children's adaptability. And so I think we're reminded on how children are flexible and adaptable. We were very surprised as teachers and caregivers how children just took to the mask mandates. And they really have been wearing their masks faithfully in preschool and kindergarten. Especially, we were surprised at the early childhood level, but actually those children are wearing their masks even better than the middle school and high school kids, I think. So, and they seem to, they've adapted to that in that way. And then the other thing we saw is that parents, we've seen a few things that about parents, they're understanding the importance of play. They saw it in action during the pandemic. They saw it in action with their teachers and the children's peers. And so that's another positive outcome. And then also parents seem to be more intentional about social emotional learning. So what we're seeing is that parents are asking questions about social emotional learning and not just about academics. So like, for instance, like, how is my child going to make friends? How is my child able to problem solve? Those things are important. How is my child doing emotionally? So we're hearing more of those kind of questions as well.
Yeah, it's interesting. If I can just piggyback on on that for a second, I think the kids who were hit some of the hardest were the kids who, particularly the young kids or kids with significant developmental disabilities who were getting services in the home because those stopped. And, to get a child whose brain already, functions a little bit differently, who's neuroatypical, and to get them to sit in front of Zoom and get speech therapy that way, or for kids and families who aren't primarily English speakers to get early intervention through Zoom. And a lot of families aren't technologically savvy. I'm not technologically savvy. So to be able to figure out how to do these things, which I think for some people, it was okay to figure out how to get services for Zoom. But I think there is that the high risk kids, I think, really suffered the most, some of the most during this time.
Yes, I agree. Children with IEPs, we at EPH, we had the learning pods because we changed to the learning pods, and the children who had IEPs, I think, had the most difficult, challenging time during this year. It was almost impossible for them. And so I do recognize that some children have less of being successful, right, in this type of mode of continuous, learning through internet, for sure. I have one question here from a parent. I'm gonna read it. I am a TPH parent, but I asked this also as a teacher, which is another one of my roles. We have noticed at our schools some general behavior issues, and we wonder how the pandemic may have impacted the kids, example, stress level, development, etc. Do you have resources for parents and teachers for how to help get kids back on board in person? This parent is asking about the transition, right? The transition from being all virtual into the transition to having face-to-face conversations with people and touching people somewhat in person. What are some of your suggestions? Sara, you want to start? Oh, go ahead, Dr. Bailey, Kasper.
Oh, Kathleen, you go ahead.
Thank you. I was just, as an EPH parent, you have, EPH is in partnership with the Somerville partner SBYC, which is part of my Department of Education. And one of the things that we have accessible to us is the Early Years Project, and they are phenomenal. They can help with mental health and behavioral challenges. They can help with social emotional support. Part of this partnership with SBYC is that it's Riverside Industries is embedded in this partnership, and the services are available. So if you haven't tapped into those, definitely ask EPH, ask the teacher, because that's an excellent resource. In addition, Somerville Public Schools, we have added quite a lot of staff to our school system as well. And so we do have resources even beyond Riverside that we can help with. And then with the Early Years Project, they have great tip sheets on anxiety, relational safety, how children feeling safe. And I can definitely send these out to Kretcha and Sherry, and they could send them out to you as well.
Oh, great.
Yeah, I have some pretty good, I have some resources I'll also get sent around. You know, one of the things that our child psychiatry folks at Cambridge Health Alliance did was put together, because it's hard to sift through, you know, the interwebs and figure out everything that's on there and what's a good resource and what's a not as great resource, or you know, they kind of did that work for us. And so I have a list of mindfulness apps and such resources that can be helpful for, you know, kids as young as 3. There's like a Sesame Street one. Not that I'm advocating screen time, but appropriate screen time. And then for the teens as well. I also have a link to a workbook, which was put out by a branch of Yale University, or in partnership with Yale University, about kind of getting kids to talk about their feelings, getting them to talk about how they're processing things. And it's free. It's available in English, Spanish, and French, not Creole. So we don't have Creole, but we do have French. And so I think that I was pleasantly surprised as I was looking through it, and I plan on going through that with my own kid too, as we're kind of getting back into things.
I think too, just something to remember is that we all speak through how we're feeling in our behaviors as well. You know, we can't always hide how those emotions are coming out. And that's especially true for kids, and for kids that may not have the words to put to what the last 2 years have looked like. I don't know if I have the words to put to what the last 2 years have been like. And so I think that it's also just really important that we're adjusting our expectations with that in mind, is that everything is not going to go back to quote unquote normal. Even the idea that we're in the new normal, you know, we're not quite past the crisis either. We're still kind of in this unknown. There's a lot of stuff that we don't quite have answers to. And so when young kids are talking or when kids are talking, I think that they're doing it sometimes by their behaviors. And so it's our job to listen and to help them put words to it. And also to maybe just adjust what we're expecting from them at that time, to help them kind of relearn how to be back out in the world. I think we're all doing that. We've been so used to this Zoom room. I don't even know what it would feel to be in a meeting with, more than 5 people. So we're all going to have to relearn that socialization. And I think it's just really important that we're being gentle with our kids, and we're also just being gentle with ourselves as providers and as parents, and knowing that we're all kind of doing the best we can right now, and that's really just important to hold on to.
I think
Go ahead. Okay, one more thing I was thinking about was also it's important to keep the structures in place and the routines.
Yeah.
And children thrive on structure and routine. So consistent bedtime routines is probably the number one aspect, is having children go to bed early, like 7:30, 8 o'clock, and is ideal. And having a bedtime routine prior to that, so they can wind down and their sensory systems can also wind down. And whatever that looks like, of taking a bath or reading a book or having some quiet time, being away from screens is really important as well. And then having a morning routine that's predictable, and if they're going to school, putting the backpack in the same place is critical, just even to manage that morning stress. And those things really do help children.
Yeah, I was going to say exactly the same thing. I think we're our kids' biggest role models, and so if we're feeling stressed, it's important to manage our own stresses too, so that we're not kind of passing that on to our kids, and that's really hard, right? Single working physician mom in a pandemic, our lives were absolutely insane. And so now that school's back in session, I locked down the screen time. Monday through Thursday, there is 0 screen time in my house, because it was just too energizing when my child came home from school, and it was too loud for me because I couldn't listen to Paw Patrol while I was trying to decompress and process my day. And then my daughter would feed off of that. So I think adding in structure, creating a calming environment, in whatever ways, sitting down for meal times with your kid. It's not easy because we're going back to getting pulled in every direction again. Right. Like there's dance, there's swim, there's church, there's whatever. But I think coming back together as a family and doing some things where you can just connect with each other at the end of the day is still really, really important. The other thing that I think is important to mention is minimize the news and minimize kind of how much you're talking about what's going on in the world. I think with the older kids, let them ask questions, but there's that age group. Like I used to be able to have CNN on in the background, and now I can't because my daughter picks up on everything, and it's just not appropriate for her. She has enough to worry about with, going to school and trying to have to figure out how to interact in the world. And she doesn't need to hear all that. So just kind of be careful about the environment you're creating for your children also in that regards.
Wow, the things that we do, because all of the things that you've described, I do. I am to blame. I have the CNN as I'm cooking, as I am on the cell, telling my staff what to do next day. And they watch all that stress, right? They watch all that stress and they replicate that stress, right? Because we're their models, and they see what we are doing more than what we're saying, and they're also imitating that. So I'm guilty of that for sure.
I am too. I always say I'm a much better doctor than I am mother, and my daughter would agree. And it's easier for me to recommend how to do things than to do it myself. But I try, and I think that's all we can do is do our best. And practice self-care for ourselves as well.
That's right. And also the other thing that I heard from you say is to keep our expectations, reasonable, because again, we are transitioning to the second year with COVID. We're not where we were a year ago by any stretch of the imagination. We're in a much better place, and we should count that and say, we have made great improvement in the way that we're handling this pandemic, but still it's with us, and we have to keep it at the transition to a reasonable steps. And I talked to my staff about this, because when we opened July 2020, we went all force with all the health and safety protocols that they could be and more, right? But this year we had to roll back some of that, because we've seen that things have improved. So we have to tell our children, things are getting better. We have to have that positive outlook, right? And say things are getting better. People are vaccinated. People are going back to work, so they can see themselves. Oh, that's true. Oh yeah, mom is going back, and so is going back. Things are going to a better place, and give that sense of hope to our children, because what they are feeding every single day, right, is a negative outlook. So that's one of the things that I also picked from the panelists. Thank you. Any other question? I want to check with our participants to see if there's any other questions. I don't see any other questions right now, so we're going to move on. And I think we talked a little bit about this. We talked about practical strategies that can parents put in place at home to ease those challenges. But any of the panelists have any other ideas of how to do this transition at home, right? We have decompressing time. We have some family time. Those are some practical ways that we ourselves can do it in our homes. What other practical ways we can help in that transition for our children?
I think one thing we're seeing is a lot of anxiety for kids, and I think that's usually, it's your alarm system kind of sounding at the wrong time. And so one thing I often talk about with parents and helping children manage their anxiety is giving a specific time to talk about what's going on. And so rather than it kind of taking up the whole day, we have, for little kids, we call it like their worry hour, and they're able to kind of talk about what's on their mind and different things that are going on and get reassurance from their parents. And the kids are reassured to know they're going to have this time to be able to talk about it, but it also isn't the whole day, that it teaches kids how to contain it a little bit. And also it gives parents an opportunity to kind of validate those feelings, because, I'm a big fan of feeling your feelings. And so it can be overwhelming to feel them all the time, but that kind of hour or that time that's specifically one-on-one. Also with older kids, I think conversations are just so incredibly important, is that, the pandemic did get us to slow down a little bit, which is important. And I think that we need to keep that, so that we're continuing to have these important conversations and hear what our kids are saying, and really, help them kind of work through these next steps, understand what this is like for them, so that we can provide that reassurance and validation, and also just know what it's like to kind of be a young person existing in this world that's happening right now.
I'm totally stealing that worry hour thing. That's part of my repertoire now, just so you know. I really like that.
I do with little kids too. I do a worry box. For some kids, that hour is not enough. So sometimes we have that you can write it down and you can put it in the box during the day, and then you pull out that box at worry hour, and then you have it's just, again, we're thinking about containment for anxiety, which is just so incredibly important. Those are my.
I like that idea. Worry box.
I think it's important to reach out early and often for support, to not feel like you have to shoulder it on your own, and to work closely with teachers and directors and clinicians and anyone else who's interacting with your child, to be on the same page about your approach, about what you're observing. And I think that's important. When we work together as a team, children benefit. Always. I've seen that for years. As a school principal, as soon as when I had a really strong partnership with the family and the teacher, the child always benefited, and I always saw so much growth. So I really encourage that, and to just reach out often.
Yeah, and utilize us too, you know, your pediatrician
And what would
or
that
family
look?
physician.
Yes, go ahead.
Oh, your pediatrician, your family physician is kind of can be very helpful in connecting you with resources. But there's a wait list right now, probably anywhere from 3 to 6 months. And so what I tell families is to, you know, feelings are real, and you should embrace the feelings and own the feelings and talk about the feelings. But when those big feelings start overtaking the child and ruining your life, instead of the child managing the big feelings are managing the child, then it's time to ask for more help. Just to kind of flip things a little bit, in thinking about older kids, their screen habits really frighten me. And I think it's really contributing to a lot of the anxieties, a lot of the unhealthy body image, a lot of the worries. And I think it's really important to monitor what your kids are doing on their screen and how much time they're spending on it. Take your kid's phone at bedtime so they're not on it till 3 o'clock in the morning. They will say, oh, I use it as my alarm, but I can buy you a $10 alarm clock. I will buy anybody a $10 alarm clock so they're not using their phone as an alarm. And the other thing is, you can look at your child's screen time. And I think before you do that, look at your own screen time. It's frightening to find out, to look at how much time you're spending on Instagram as an adult. I've had teens in my office who were literally spending 16 hours a day online. And I'm like, and this was pre-pandemic. I'm like, that is 2 full-time jobs, child. You could have made $1,000 a week, right? Like if you were doing something productive during that time. And so just really being mindful of that. And then what's happening is the preteens and the teens are staying up till 3, 4 o'clock in the morning, playing video games on social media, on YouTube, on TikTok. They're not seeing daylight. Their circadian rhythm everything is pushed back, but because they're staying up so late, they're not interacting with people. They're not seeing the sun. They're not getting healthy sleep. And routines, I think, are so huge at that age to just keep everybody healthy.
Definitely. And the reason that I think that you're underlying the screen time is because during pandemic, I think everybody shift to the screen time. And that was our refuge, right? That was our work, our study, our entertainment. It was everything to us for so many months. And so how can you say, but now we're not doing screen time anymore? Now we cannot, and it's just, again, it's a transition. Now we're going back to what we used to know. And we have to have more of that human contact because we lost touch with reality for many, many months. And so we have to retrain ourselves, us parents, and we have to retrain our children of how to come in contact with people again. So it's a relearning actually that we are engaging our children to do. So it's going to take a lot of patience, a lot of care, and a lot of love to do that. So for sure. Let me ask you about specifically, and this is a very interesting question. It's the balance, right? How can parents establish a balance between keeping children safe while at the same time not limiting their growth and development, right? And again, I'm the first one to be guilty of this. Do you have the mask? Do you have disinfecting gel? Do you have this? Do you have that? Before they go out and I have a 17-year-old and an 18-year-old, right? Before pandemic, they were 16 and 17, but that's how I, do you have this? Do you have that? Do you know that you cannot, all that? Do you know? Don't. please, 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 begging. And so now we're at a different point. So how can we as parents balance protecting them, but at the same time, they have to take chances and they have to interact with people and they have to interact with other children. So.
I mean, Kretcha, I think you said the most important thing is like you're letting your children out of the house, right? And I think that's huge because we can't keep kids home forever. And I have families who are homeschooling their kids right now. I have families who are still so nervous. They've come into my office and said it was the first time the child has been out of the house in the past year and a half. And I think that's not ideal. But I think listen to the science, right? Ask your doctors, do your research, but don't do your research on YouTube. Wear masks, set a good example for your child. Even if you're vaccinated, wear a mask because your child can't get vaccinated yet. And if your child's old enough to get vaccinated, please, please, please get vaccinated. I know there's questions around the vaccine. I know there's a lot of hesitancy. I know there's a lot of fears, but it's our only way back to normal at this point. And so talk to your healthcare provider about these things.
So I actually had the experience of becoming a parent during the pandemic. So I have a 5-month-old, and so have had to completely kind of change my approach. And I will say that my pediatrician has been extremely helpful in the experience of kind of weighing those risks of what's going on and what's best for my family.
Mm-hmm.
I think too, the way that I've tried to look at it and talk to parents is that the pandemic's not stagnant, that things are constantly changing. The level of risk in the community is changing. There's all types of things. And so what we did today may not be what we're going to do tomorrow and yesterday. Every day is kind of a new day. And so doing your research and understanding that you wanted to look at the most recent data of what's happening and make your decisions based on that and what's best for your family, that you have to be able to weigh that out too. And that's what I've discovered is a job as a parent too, which can be incredibly difficult and incredibly anxiety provoking too, but to use your supports around you as well.
Yeah, Sarah, that when you were talking about risk management, I was thinking that too. It's very individualized. Each parent needs to make their own decision. And then it also circles back to what you were saying, Dr. Kasper, about how you're seeing children who are more obese and who have gained weight. And I would just say the number one thing is to get them outside and play on the playgrounds. That's the beauty of this area. We have so many playgrounds and they're wonderful. And every day I'm housed at Capuano Early Childhood Center, and I've noticed the parents who have picked up their children from CAP and then they just hang out at the playground and let them play. And I think that's just so important. Just letting the kids play.
I think, Sarah, like you were mentioning too, I think it's important, talk with your kids that everybody's, what people can do and can't do and kind of their comfort level with being around other people, it's going to be different. And so, somebody may have a sick relative at home or an elderly relative at home or a newborn at home. And so I think, making sure that you're helping your kids understand why they can and can't do the things that you guys are asking of them, but then also how, that may be different for somebody else as well.
The other thing is children are extremely creative. So one of the things we're seeing in the classrooms is children, they're naturally understanding what physical distancing is at this point. They're becoming used to it. It's part of their repertoire, and they're being very creative on how to play with somebody else but be physically distant, or how to play with somebody else and wear a mask. And so I'd take the guidance from your children as well.
Yes, at EPH, the first months that we started, they were definitely telling us how they were going to roll it. So we will say social, and they will go and open their arms and say distance. So they knew that we meant that they had to be apart from each other. And we try to make it, as fun as we could, so that they would not be negatively impacted by all the different things that we had to do. And I think as parents, we have also ways that we can make things for them that it's fun and that it's doable for them to do, and to be able to be in the positive and not always like, I have to do it because my mother tells me. No, you have to do it so you can be healthy and safe. I want to see if there's any questions. This participants are very quiet tonight, but I want to invite them to put their questions on the chat room so that we can ask to our awesome panelists. Any last remarks that the panelists would like to share with us with regards to this year? Like, this is going to be a new year, right? What do you see some of the things that we are looking forward in this year of school year? And people be more vaccinated. What are your hopes for this new school year?
I mean, my hopes are that, I'm hoping that people continue to get back into their routine healthcare, right? If your child hasn't seen their physician in the past year and a half, please come into the office, please make an appointment. Your child's probably due for vaccines. I'm urging people to get the flu shot this year too, as soon as you can. We have it already. We keep blowing through our supply, but we have it. We're seeing respiratory illnesses that we usually see in December and January. We're seeing them now. I think the year and a half of masks kind of took the respiratory virus world, and just, it's so confusing and unpredictable right now. So I wouldn't be surprised if there's a bad flu season. And then, I don't know, I think it's really hard to trust healthcare professionals when the news keeps changing, but the science keeps changing because we keep getting more information. And so please trust us. Where we work so hard to keep your kids healthy, and to do what's right for them. And we don't give advice lightly. So please ask us questions and have conversations with us, and try to trust us.
Thank you.
I think one thing I hope is that people are just able to reclaim joy, because I think that is such at the root of so many mental health worries, is that we're missing out on these really just wonderful moments. I mean, we've had all this time of not seeing family and interacting with friends, and just, everything even feels heavy and trying to do it, even like going out to get ice cream, you have to have your masks, and who are you around, and who's in your, all of those things just feel different than they used to. And I think it would just be so lovely to reclaim a little bit of joy. I've had this activity I've done with groups and, different individuals I've talked to, where you just list everything that brings a smile to your face, these really small moments, and just try to embrace them, whether it's like that hot shower after a beach or the first sip of coffee in the morning, just being able to live in those moments, because those are what recharge us and help us kind of continue to keep going, especially when we're not able to get access to the services that we need, or things just feel really heavy. Those can kind of bring us back to these really simple, joyful places.
That's awesome. We started the year this year as an early childhood department, talking to teachers about creating joyful, connected classrooms. And I really believe that is the key, that for young children, that they're joyful, they're playing, they're exploring materials, they're being creative, we're listening to them, we're going with their ideas and honoring them as individuals. We're celebrating diversity, we're celebrating our uniqueness, and we're connecting with one another, because that is absolutely critical. And we are social beings. We need to be connected. My hope is that in every time I go into a classroom, my hope is that the children are engaged and they're playing and they're joyful. And then my hope for parents is that they partner with us. They partner with the educators. We're in it together. I think we learned that last year in the pandemic, that we can't live without one another, right? That we need both to really, it takes a village to raise a child, and that we're the village. So I think that's really important. I also would want parents to, the routine of going to school is really important. So if they're going to a program or going to in school age, is going every day as much as possible and having that routine. The children are literally running in the doors. They are so excited to be with their friends. And I see like a weight off of parents at drop off. They're like, phew, like you have them now, right? And that's huge. And parents are so excited to drop off the children as well. But that, the schools, the Somerville Public Schools, we're really doing our best to keep children in schools. We want children in schools. We're routinely testing to make sure they stay in schools, because school is a safe place to be, and it's a place filled with joy and friends. So that's my hope, is that we can just remain in schools, be as healthy as possible, and that we get through this together.
Thank you. Yeah, and my hope too is that we have a stronger partnership, not only with the city of Somerville, with the school district, with Cambridge Health Alliance, but also with our parents, right? Because I think that that's what really sustained us last year, is to have that relationship with the experts in the field, and consulting and asking questions when we're not sure, what the answer is, and seeking guidance and seeking advice, because we're not, we're in this together. And so I just encourage parents to ask questions, to ask your early childhood educator questions about, if you don't know why your child was crying or was upset, or ask questions so that we can follow up and see what's going on with your child. And if we need to find other people in to come and see your child, then we will do that through the Early Years Project and through Riverside and through our consultant with Dr. Kasper and Sara, because we're here for the benefit of our community. So I want to thank you all. Thank you to our participants. Thank you to our panelists, and for the professionals who came also and join us later tonight. We hope that we can continue discussion not only about COVID, but other topics that affect our children, our young children in the city of Somerville. And we hope that we can have other parents join us and giving us ideas about potential topics that we can talk among ourselves. So I just want to thank you all. I appreciate your time. I appreciate your information, and I do appreciate your partnership. Have a good night.